With all that in mind, I had a chance to speak with Vice President of Patient Care Services at Sisters Hospital and its St. Joseph campus, which is ground zero in the local fight against COVID-19. Tonight, my in-depth interview with Jessica Visser and the emotional state of healthcare workers during this second wave of the pandemic.
How are you doing?
It's challenging right now. I think for all of us as nurses, it's been a long 8 months. It's day by day. Each day is different, and we face different challenges each day.
So because there's so much juggling going on as you get more and more patients, what does that do to just the staffing logistics and the overall care that goes into each patient?
The logistics of staffing, I think, is one of the most challenging pieces of COVID at this point in time. And I think that's something that's different from the spring in the sense that in the spring, we were kind of ahead of the rest of the country. So it was much easier to get outside nurses to come in, whether it was agency or travelers or, different opportunities in that way. And that's become more challenging at this point in time.
And does that require quite a few tough decisions to be made?
It's been challenging, but incredible too, to just see the way that the nurses respond to the need and are willing to step outside of what they usually do, to do additional training, to take on, assignments that they haven't had previously.
We also are hearing a narrative across the country that healthcare workers, and I think particularly nurses, are exhausted. Is that reflected at your hospital?
It is. People ask me what keeps me up at night.
Please take your time.
We are tired, and it's hard to watch. It's hard to watch. The nurses are coming to work day after day. They're picking up extra time to make sure that we have the people here that we need to take care of the patients. And they're tired. We've been at this for a long time. The first wave, it was different. We went into it with this sense of energy. We didn't know what we were going to deal with, so there was anxiety with it as well too. But I think, just having to deal with it for such a long period of time, and now to see, so many more patients coming in again, it's challenging. It's exhausting. We miss the normalcy of what we used to do and how that looks now, and it's so different.
Do you have a message for the community?
Just stay safe. Follow the recommendations that are out there, the social distancing, wear your mask, practice good hand hygiene. But I would also ask, just remember us, keep us in your thoughts and your prayers. We are tired, but we're here, we're showing up, we'll keep taking care of you to the best of our abilities. That's what we do.
Visser, driving home tonight, the decisions that you and I make, where we go, who we see, how close we are to each other, that all has a direct impact on what happens inside the hospitals.